It's so detrimental to say that the physical body is separate from the mental, emotional, spiritual self. They are one. And in this country, we look at them as separate. And they're not. There's literally no way to separate them.
So you're calling it medical trauma brain.
Or MTB. I interviewed many, many physicians, the people that I'm closest to as well. And I said, have you seen this where the patient is better, but they're not better? Or it's like they're better, but they're still acting as if they're sick? And when I would say it, there was a real recognition of, oh yeah, I see that all the time. And then I'd say, what's the name of it? And nobody knew. So I created it.
Amy Kurtz is a certified health coach, a patient advocate, a speaker, and an author dedicated to empowering patients to reclaim agency over their physical, mental, and emotional well-being.
I was physically better, but my mind was still on the survival hamster wheel and it hadn't gotten the memo. And so for me, it was like an illness after an illness. It applies to cancer patients, to patients who have had acute illnesses like strokes. You are in survival. And unless you work to get out of survival, you will always be stuck in what I call the shadowlands. It was like I was out to dinner with my friends. I was having a good time, and yet there was a part of me where my brain was like trapped in a sandstorm desert all alone. I was so anxious. Like I was really, really struggling because I was terrified that I was going to get sick again.
Amy has been featured on Good Morning America, Oprah Daily, the Boston Globe, and so many other media outlets, including Wanderlust, where she was named one of their 35 women under 35 to watch in wellness. Please join me in welcoming Amy to the show. Hi, everyone. It's Dr. Taz. Before we get into today's episode, I just want to pause and say thank you. Your messages, your shares, your stories are the reason we make Whole Plus. Every conversation here is about connecting the science, the intuition, and everyday life together so you can feel more like yourself again. If you haven't already, hit that subscribe or follow button. It helps us reach more people who need this. All right, let's begin. Okay, Amy, there's a reason I brought you on this show. These are the words I heard, and I think you've heard them too. You know, you're normal, your labs are fine, you look fine, everything's okay. I think this is all in your head. I was told that back in my mid-20s when I was on my own health journey, and I have met countless of patients since that time. It's been over 25 years since then, who have heard the same lines told to them over and over again. When I was reading your story and kind of what you've been through, I really resonated with a lot of what you've been through as well. So I think you've heard those same exact words uttered to you, and it motivated you not only to heal yourself, right, but also to really create something that will heal others. So tell us a little bit about what you went through.
Well, I have had a long and winding journey with medical health conditions that felt like a mystery for a long time. I started having pretty intense pain when I was 14, went to a bunch of doctors. Nobody really could identify the root cause of the condition, was put on anti-inflammatories, managed, but my life really shifted in that moment because I went from being a young, vibrant kid to being a kid in pain. And then I managed, and then at 25, I went abroad and had really a health crisis where every system in my body started to really struggle. I came home, I gained 30 pounds in 30 days. I couldn't breathe. I was losing my hair. It was so intense and so fast. And it sent me on a quest to figure out what was happening. But the answers weren't clear. And the situation was so dire that it demanded a different medical system than I was used to. Like, I come from a very Western-minded lineage of physicians. I love Western medicine, but for what I was going through, I found myself looking in different directions than anything I had ever known. I went all the way to Eastern medicine, found myself somewhere in the middle, found functional medicine, which greatly helped me. But still, for 10 years, I was wrongly diagnosed, not with things that I didn't have. Like, I do have hypothyroidism, I do have celiac, but what ended up becoming was that after the press for my first book, Kicking Sick, I thought, I don't have this figured out. I feel like I'm this glowing picture of health on the cover of the book, and I would go home and feel like, I don't know how I'm gonna do this. I feel like I'm crashing. I know my body. I know something's wrong. I went to my 36th doctor,
36?
and he looked at me very clearly. You know, I brought my Harry Potter anthology of medical records. I put my hope and trust and finances and all of my energy into one more doctor because I had
Right.
heard wonderful things about him and I wanted better for myself. And he did all the testing again. I was hoping and praying that he would have an answer for me that actually made sense and didn't make me feel like I was treading water. And he looked at me very clearly and said, I know exactly what's going on. You have late stage neurological Lyme and co-infections.
Oh, wow.
And it was like everything inside of my body knew it was true. Every part of me. It vibrated through me like I was so proud that I hadn't given up on myself.
Right.
But I also felt a tremendous amount of grief for the invalidation or the gaslighting that I'd experienced, the years that I lost from my young life. I mean, 25 is the time when you're supposed to be flourishing
Right.
into who you're about to become. And I was moving back home with my parents to try to figure out what was wrong.
That's around the age that I got sick as well. And
Oh,
that's just such a
pivotal moment.
Such a pivotal moment because you're supposed to be like excited and, finish college, finish med school, finish all these different things. And instead you're starting to take steps backwards in some ways.
Yeah, and
So,
it just isolates you
yeah,
so much further than the experience of being sick in general, which is
right.
already so isolating. But it's like you're watching everybody that's your age become who
Who they're supposed to be,
and you're like,
you're
"Wait,
left
I'm on pause."
behind. Yeah.
So, yeah.
So
So,
frustrating. So this is a 10 to 12-year journey for you where symptoms actually set in around 13 or 14, but you don't really get your diagnosis until about 25-ish or so. Is that
I
correct?
didn't get the Lyme diagnosis until 35.
Until 35. Oh my gosh. Okay. So, that is a long span of time. That's like
Yeah.
a 20-year span of time.
Yeah.
And looking backwards, it's always easier to look backwards, right? And kind of, see your journey in hindsight. What was being, I don't want to say dismissed, but what were you telling doctors, even starting at 14? What was the input you were getting back?
At 14, I just remember people saying we don't have a clear idea of what's happening. Maybe it's growing pains. It didn't feel dismissive at that age. It just didn't feel clear. And I was a child. So I was
Right.
like, okay, well, I guess then I'll just take these anti-inflammatories. And
Did
it
they
wasn't
work? Did the
a
anti-inflammatories
little
work?
bit,
Okay.
but
Did you have labs done or any tests run at the age of
everything. And
14?
I went
Okay.
to good doctors.
Yeah.
My father's a physician. Like I
Okay.
went to good specialists and I
Uh-huh.
had the privilege of doing that. And I still didn't have an answer. And it's kind of ridiculous because I grew up in the Lyme Belt,
Yeah.
but nobody was talking about Lyme in the 90s.
Right.
I don't know
I
anyone
remember.
who
Yeah.
ever was talking about Lyme. Now I look back and it's so clear based on my original symptoms that I was bitten
Mm.
that young. And I
Mm.
think everything else just sort of snowballed.
So you take these anti-inflammatories, you get through high school, you go to college, I'm assuming.
Mhm.
How are you managing day to day? What's happening?
Well, it's funny because you really adjust to your baseline. And
Yeah.
I think I had just adjusted to being uncomfortable. Like I almost, looking back, think I thought that was normal, that I was in pain or that I just, now I'm like, oh my God,
Yeah.
that's
Yeah.
so not normal that you felt uncomfortable all the time, But I just
Is
thought
this
this is just
something like
me.
someone outside of you could see or not necessarily?
No.
No, this is all internal. Like you're trying to
Yeah.
just make it through, not talking about it, not telling people about it.
Yeah. No.
No, managing with anti-inflammatories, I'm assuming.
Mm-hmm.
Wow. Okay. So then when the crisis component hit, what was happening there?
It was.
And there's a reason I'm asking you these questions. I'm not trying to interrogate you here, but the reason I'm asking is because so many people do exactly what you did, that they have this inner knowing of something's off, something's not 100% right. I don't feel great, but they learn to silence it. And they silence it in different ways. They may take medications, they may sleep more, they may say no to things that they could have said yes to. It looks different on everybody. But that like silencing of your inner intelligence is something that I think really works against us. And I think that we've been trained and taught to not trust that. So you're moving through these years, it sounds like, trying to patch it, like, okay, it's fine. Let's push it down,
Yeah.
pretend like everything's okay. What forced you, like I had that same moment, like, but what forced you to be like, okay, we can't keep brushing this one under the rug?
Well, when I went, and I fully agree with that. I often look back at my life now and can see that when I was 14, I was just trying to fit in.
Yeah. Such an issue
And
for teens. Yeah.
being a 14-year-old girl is hard enough. I mean,
Right.
it's pretty brutal. So I could see that I was just trying to adapt and be as normal as possible. But now I look back and see that that's actually detrimental to
Mm-hmm.
be putting on a mask or pretending things are fine when they're not.
Yeah.
But it wasn't until I got back from my trip abroad and I had clearly eaten something wrong and there was just a tipping point that had happened that I said, okay, my body's in an emergency mode now and I'm not settling for unclear answers.
Yeah.
So that's what made me take my health into my own hands. I had only grown up around Western medicine and I went in every other direction.
Wow.
And I realized, okay, I'm going to try to make myself feel better. So I started learning about anti-inflammatory diets
Mm-hmm.
and mindfulness. And it sent me on a journey that I actually look back and feel grateful for because I found a depth within myself and an empowerment within myself that I don't think I would have necessarily found if it
Yeah.
hadn't have happened.
Yeah.
But even so, at that point, I was fighting for answers and I still didn't have clear answers for another 10 years. I
Wow.
had clearer answers, but I really was just in survival mode, throwing spaghetti at the wall to see what would stick, trying everything everyone gave me. I didn't even know what was working anymore. There were some things that really helped. There were a lot that really didn't.
Mm-hmm.
And along that way, which I think is a very universal feeling for many patients with these invisible illnesses, there was a lot of gaslighting
Yeah.
and invalidation and making me question my trust in myself,
Mm-hmm.
which I think is one of the most detrimental things that can happen to a long-term patient,
Yeah.
is that the experience of it within a system that doesn't support the gray can really erode your trust in yourself.
I think that's one of the fundamental flaws of, we can talk about the medical system from here to eternity, but I think one of the fundamental flaws of the medical system today is that it is not designed to treat anything other than the super, super obviously sick, right?
Mhm.
It helps the extremes, but it's really not set up for the gray zone. It's not set up for the preventive zone,
Yes.
or the optimization zone by any means. And I think that that journey, just thinking about you going from 14 to 25 and not having a system that says, okay, hey, let's track your markers. Let's see where they're going. Okay, they're moving in a different direction. Yes, they could be quote unquote normal by the standards we've established, but they might not be normal for you.
Yeah.
If you were tracking those, if we had a system that allowed tracking of those on a consistent basis, then maybe we could catch people before they had this critical point, right? Or this
Mhm.
crash out point and be able to turn it around, and then have another, have the proper mechanisms in place to turn things around. So we have a twofold
Yeah.
issue of not tracking and trending and individualizing, but then also not really having the toolbox on the other side of that.
Mhm.
But okay, so you have the final tipping point. You're going on this journey of seeing all these different people. What were they telling you?
When I finally took my health into my hands and
Yeah.
started to see people who had really good reputations that I had done my research on, who looked at things holistically, who were functional medicine physicians, that's where I landed. Um, they diagnosed me with hypothyroidism. That was true.
Okay.
I have celiac. That's true. But I was better. I just didn't have a baseline for what health really felt like
Mm.
anymore. And so after I wrote my first book. Like I said earlier,
Kicking Sick,
I knew
right?
something was wrong.
So when was that first book? When was that?
2017.
And where were you on this journey at that point?
I didn't have my Lyme diagnosis.
So
So
you had
it's
your
literally called Kicking Sick, your go-to guide for thriving with chronic health conditions. And I still stand by everything I said in it. However, I was treading water, and all of the things that I put in there really do help me, and they really did help me. But what was so insane is that I would go home from press and feel exhausted.
terrible.
And I would feel like, I don't know how to have the energy to meet this moment that I feel so lucky to have. And I wrote this book because it was the book that I needed.
Yeah.
I couldn't find literally anything out there besides How to Be Sick and Tired. And I was never willing to subscribe to that.
I want to pause here because I see this pattern all the time. People are doing the research, they're listening to the podcast, they're trying to take better care of themselves, and they still feel so stuck, especially when it comes to their health, their hormones, their stress, and even taking care of their families. That's why I created The Circle. The Circle is my private membership where we go deeper into these topics with real guidance, demos, live sessions, and a supportive community. If you want to try it, there's a 1-month trial available right now. You can learn more at wholeplus.co/circle. That's HOLPLUS.co/circle, or just click the link in the description below and use the code YouTube. Now let's continue the conversation. So what motivated you to write the first book then? You must have been feeling better than your previous
I was.
baseline to be motivated to even write that.
I was.
What was happening when you were writing that first book?
Well, I felt so much better. I started eating an anti-inflammatory diet. My pain went away in my back. I started to help my thyroid. I felt so much better. So I really thought, okay, this is like what I have to deal with. And in the darkest moments when I had to move back home with my parents, I remember just searching for something to give me hope, something to give me ways to help myself. I was desperately searching for that. And all I could find was literally the book, How to Be Sick and Tired. And I just was like 30 plus years old. I'm like, I'm not going to live like that. There's no way that can be it. That can't be it. That can't be the answer for young people with chronic illnesses. So I decided I had spent so much time, money, energy, emotional investment. Yeah, thank you. Trying to find people that could help me, from doctors to healers to thought leaders to meditation teachers to everything. And I just wanted other people to have a resource guide so that they didn't have to waste time, energy, and money trying to find the right people. So it was really a love letter from my heart to any patient that's struggling with chronic health condition. And at that time, the statistic was 1 in 2, 150 million people had at least one chronic health condition. So now it's 194 million.
Yeah.
So that's a huge leap. That's a 25% increase between both books. And I just felt like if I'm suffering this way, then so many people are suffering and want to help themselves. I mean, it can't just be How to Be Sick and Tired. That cannot be the narrative anymore.
And then, so 150 million in 2017 to 194 million today in 2026, a decade, right? Roughly between the two timestamps. That's a really big number. And I think it's skewing younger. Do you know if it's skewing to a younger demographic necessarily or not? From what I see in practice, it seems to be.
Yeah, I think you would know that better.
Where
than
I
me.
get a lot more young people coming in, symptoms that you can't explain very clearly. But I guess the common symptom is like chronic fatigue, brain fog, it's kind of this cognitive fog is probably the best way to describe it. And then something else, like it's usually that plus a few other things. And it seems to be skewing, younger and younger. And, it concerns me for younger people. I have a daughter who's 18, a son who's 17, of what that means. Is it environmental? Where is this all coming from? And we talk about it, frequently. Is it just the modern it's like the modern disease burden. We had an infectious disease burden in the past. Now, is this the modern disease burden, this like chronic inflammatory something,
Mhm.
But you write this book and you hope that people will be helped by it because you've invested a lot, spent a lot of money on your health journey. And then you go home in 2017 and you're feeling like crap. Like, what made you realize that you may not have all the answers yet?
I just knew it. It was an intuitive, deep voice inside myself saying, this isn't it. Because,
That inner intelligence again.
yeah, and I trust that voice, and I always have. And it may have been under cobwebs for a little while, but
Right.
I just would come home from amazing opportunities to share my voice and share my story and help other people. And I did. And then I would just come home and feel like I don't know how I'm going to do this.
Mm.
And it was so painful because I had this beautiful opportunity in front of me. But I wish that I had known what I know now and done it. Maybe it just would be different.
Yeah.
But anyway, I really am grateful for that because it allowed me to stop and say, okay, there's still something going on. I know this because no matter what I do, I cannot find the energy to meet any moment the way that I want to.
Interesting.
And that was a hard reckoning, like especially being in the position that I was and feeling like, do I do this again? I've been to 35 people.
Wow.
Like, do I do this again?
Yeah.
But I believed in myself and I wanted better for myself. And I had heard of this physician for a long time. I had always sort of been thinking about him in the back of my head.
Yeah.
And I just sent him an email, told him what was going on, told him how many people that I've seen. And I knew he had a wait list. And I just said, will you see me?
Yeah.
And he said, yes.
Amazing. So let's talk a little bit about Lyme because I feel like it's one of the biggest sort of misses. There are a family of diagnoses that I feel like, first of all, are very difficult to make. And then secondly, get missed frequently in the exam room. I feel like Lyme is one of those. Epstein-Barr is another one. Mycoplasma is another one. A lot of these sort of chronic infections. Why are we so confused about Lyme?
That's a loaded question.
I know. That's why I asked.
I think we are, I know we're behind.
Yeah.
And it is very sneaky because I believe it's under 30% of people get a bullseye rash, which is a clear sign that
that's what we've been trained, like look for the bullseye rash.
Right. But if only 30 people get that rash, how many people are missing that they've been bitten by a tick? An acute infection is so different than a long-term infection. But once you reach late stage, it has infiltrated into your body and it is called the great imitator for a reason. It literally survives and mimics other conditions. And it certainly did for me.
Wow.
So,
do you think you were bitten at like 14?
Yes.
Oh, wow.
Because at first I wasn't sure. Like I could only see some missed signs in my labs in my 30s, in my 20s. There were things that should have been checked that were missed. But I know now, knowing what I know and knowing what the onset symptoms can feel like, that I have no doubt in my mind that it started then. I don't have the labs to prove it, but I know it.
So Lyme, the way we were trained, right? And you already know this because you've seen so many physicians, but you get bitten by a tick, you get the bullseye rash, you go on a short course of doxycycline, the story is usually over. I think conventional medicine accepts like some people may develop chronic Lyme, but chronic Lyme is, limited, may flare if your immune system is weak, those type of things. How is your experience different?
I was so ill and I was in so much acute pain when I was young. It wasn't just physical pain. It was nervous system pain. I could feel people behind me. It felt like my nerves were jumping out of themselves. I didn't have the classic joint pain or flu-like symptoms. Like I've sat with my mom and been like, what was happening at this time? Asked her. But it's been really a very interesting experience to learn more. I'm on the board of a place called Project Lyme. It's a wonderful
Yeah.
foundation, and there's so much that we don't know that's
Mm.
not in the mainstream about how to remove a tick,
Mm.
how that we should be sending it to a lab if you find it so you know what infections it has. Um, and a short round of doxycycline,
It's not
from what
enough.
I've heard, doesn't work for people. It's not enough.
Yeah.
And so I just think that there's not enough information, and it's such a growing epidemic. I mean, literally right before the actual pandemic, I was at a gala for a Lyme disease foundation, and they said this is an epidemic that's
Wow.
happening. And then the pandemic hit.
Then the pandemic
It
hit.
was like-
So the Lyme Belt you mentioned, it's really this northern area of the country, correct? Are there
Yes.
other areas that should be concerned or be thinking about it?
I think it's everywhere.
Yeah, I do too. So, I'm in Atlanta, based in Atlanta, and
Mhm.
I go back and forth. But I know in the South, they don't think Lyme is even a possibility. They're like, we don't have ticks in Georgia. We don't have, Lyme ticks in Georgia. And I know that that's not true, right? Because we've seen it there as well. Do you think doctors and patients, today need to be thinking about Lyme disease in the differential, no matter where you are, not limiting it to geography if you're having like chronic pain, neurological symptoms, I don't know if there is anything, joint pain. I don't know if there's anything else you would add to that list.
Also, if you've been in a more wooded area and you have intense flu-like symptoms, that could be a sign, like intense body aches and symptoms like you feel really ill.
Yeah.
I think it's everywhere. I know someone who got bitten in Central Park in New York City
Oh, wow.
because a dog had been upstate and came to the city, and
Mm.
it's not something that can be ignored. My doctor says he has tick-borne illness patients all over the country.
Yeah.
So I think it's something that everybody should be aware of. And the most important thing at this point is being preventative, which a lot of people don't talk about.
Right. And how can you be preventative?
Well, there's a lot of things you can do. One is if you live in a wooded area, you can
Right.
get your lawn sprayed with permethrin. I do that every other week because that's the cycle that ticks grow in. Also, I check myself once a day
Okay.
because ticks can be as little as a poppy seed.
Mm.
So if I'm staying outside of the city, I'll just do a quick body check. They like staying in dark places,
They
like
like the
your
scalp, don't
scalp,
they? Yeah.
your
Yeah.
armpit,
Yeah.
like anywhere that they can hide, they will. And it's not to be like hypervigilant about it. That's not what it's about. It's just about saying, okay, this is something that's affecting so many people, so I want to be careful. My very good friend created something called the tick mitt, which is a mitt that you can literally put on your dog or literally put on your clothes after you've been in a wooded area. And if there's a tick, it will stick. You put it in the dryer for 15 minutes. It's so smart.
Yeah.
And it's really just knowing, okay, if I do find a tick on me, how do I remove it properly? Where do I send it? How can I prevent something from affecting me? Because what I know is that the people who have suffered with it long term, it is so debilitating, and it does not discriminate against anyone.
Wow. What is the right way to remove a tick?
They say to take a thin-tipped tweezer and
Okay.
to remove it from the head,
Right.
because you don't want to take the body off and have the head still
in there.
because it can, I think, I don't want to be quoted on this, but I
right.
think it can release more. And then you would send it to, there are plenty of labs
Yeah.
that you could send it to get it tested, because then a tick can have up to 12 co-infections.
Yeah.
I have 3.
Yeah.
So, if you got bitten, you can see what that tick had and know accordingly. It's just an empowerment thing. It's saying,
Right.
okay, I'm going to get ahead of this instead of be behind it and just wait and see.
So what was the lab test that finally diagnosed do you remember, that diagnosed your Lyme disease?
So
'Cause there's a lot of debate about testing.
well, that's
you
the
know?
other
Yeah,
thing is
yeah.
that if you have late stage Lyme, a blood test is not going to show
Right.
it. And that's what makes it extra complicated. I am the type of person, like, I want to go at every angle and prove it. So I did what he recommended, which was an IGeneX
Yes.
full panel,
Yes.
Armin Labs.
Okay.
And I did one other lab that I can't remember in this moment, but just so I could see the 3 results, and they all lined up.
Wow.
And I think there's also a misconception about late-stage Lyme, which is that some people say, well, do you ever really get better? But I feel like I have a whole new body.
Wow.
And every time I've treated an infection, I've felt better and better and better, probably than I ever have in my whole life.
So what were the 3 co-infections that you had?
I have
I'm just curious.
Bartonella and Babesia
Okay.
and Lyme,
So
Borrelia.
did you go on separate protocols for each of
Mhm.
those? Can you tell us a little bit about what started to turn you around once you got the diagnosis?
Sure. I think number 1 is my doctor suggested to me, and he does both antibiotics
Yeah.
and herbs, that
Right.
he thought I would have an easier time with an herbal protocol, which is sort of what I preferred anyway.
Right.
However, once I knew that this had been plaguing me, I'm like, get this out of me as fast as possible. Let's do whatever. But I've done mostly herbs,
Okay.
and I've had a profound reaction.
Really?
And he said, you will get sick before you get better. It's a die-off treatment. It will cause a Herx reaction if it's working. And it did. But because I knew that it would be like climbing a mountain and then getting to a new apex, I was like, I believed in myself. I believed him. I really trusted him. And he was one of the first doctors that wasn't throwing so many things at me at once.
Right.
So we went slow and steady. And then I treated Bartonella first because my symptoms were mostly Bartonella based. It seemed that that was like the dragon I had to slay.
Right.
And I really did feel like, wow, he was so right. I am a different person.
Wow.
And then I went to the next one. So it's been a long journey, but I'd been living with it much longer. And there is hope. It's just really, if anyone's struggling with Lyme or feels that they may have Lyme, seeing a Lyme literate doctor is essential.
Yeah. And you found success treating each, stair-stepping the treatment of each co-infection rather than trying to treat everything at one time.
Yeah.
Correct?
I found the relationship with this doctor very
Important.
so crucial because he empowered me.
Yeah.
You know, he said, I'm going to give you the answer. I'm going to give you the treatment, but ultimately the pacing is totally up to you. And I almost was like, wait, what? Like, up to
I get
me?
to choose?
I get to choose.
So, yeah.
I get to decide
Right.
how I'm going to do this. And it felt uncomfortable. Like I say in my new book, I almost felt like a kid in rain boots being like, wait, I can splash?
Yeah.
Because I wasn't used to that. I was
Right.
just used to always doing what somebody
Told you to
told
do.
me to do
Right.
because they were the expert. And that was so crucial to my full whole healing,
Yeah.
is that I had to step into it.
Yeah.
And he pretty much demanded I met him in the middle without saying that. And just doing that gave me so much agency over my health in a way that I had lost over the years that I was struggling. And I really, truly believe that that's like essential to full healing.
It's so funny because, we're living in a time where, people are like, oh, we're not going to need doctors. We have AI and we have technology and we have this and we have that. You can go get your labs. You can interpret them yourself. You can upload them here. There is no healing without a doctor-patient relationship.
No.
There's simply not. You can take stuff, you can do an algorithm or a protocol, but to truly be on a healing journey, it's this energy exchange that needs to happen between two people that are sort of mirrors in a way. Like
100%.
Here are some answers. How do you feel? And then you guys take that and you re-input us. Like I've evolved because of you, because of all my patients, right? That's why I've evolved into whoever I am today, because it's this constant exchange of energy and learning and kind of honoring every person's individuality, but more importantly, not to be too weird about it, but to be like, you know the answers internally, right?
Yeah, it's making me cry.
I don't make you cry, but I think that's the goal. It's like to get each person in that construct to where they know, and then trusting that intuitive knowledge, right? And technology will never ever be able to replace that.
But it
will
also
make us efficient. It'll find answers faster. Trust me, I like my chat and Claudes and all those things. but it won't replace what happens in the exam room, you know?
No, especially if you have a doctor like yourself. Like, I can tell this just from talking to you so briefly that um you trust your patients.
Yeah.
And that is so healing because the traditional Western medicine system, the system for patients with complex, invisible chronic disease, not just one thing, often feels so disempowered. And to have somebody say to you, what do you think it is? Or how do you think we should do this? Or what's your instinct about what's going on? Or does this feel right to you? Just those questions is like throwing a patient a lifeline. It is empowering them, and it's also trusting their ability to know themselves, which is what got them there in the first place.
Yeah. I mean, you had a long journey. You had 20 years. That's a long time. How did that impact your life? Like the basics of life, what career you chose, relationships, all these other things.
Oh, so significantly. I mean, so significantly in every way. My whole life changed. It felt like a rug was ripped out from under me when I was 25. And when I was young, from age 5, I looked at my mom and said, I am going to be an actor. And she's like, okay. And I said, that's it. And there was no other path. I went to college for it. I started acting professionally, and then boom.
This happens.
And I was a patient. I became a patient. And it's funny because I look back at my life before. I used to always see my life as like before illness and after. And I sort of was like, oh, I'll just do this and then get back to where I was. I'm just going to get through this and go back, and I'm going to be an actor, and I'm going to do this, and everything's going to be the way it was. And then once I was finally better, nothing was where it was. Everything had changed. Everything. The cruise ship was gone.
Yeah.
Like, there's this societal expectation, which I talk about a lot in my new book, which is you're sick or you're well, and if you're well, get back on the horse. But the horse isn't there anymore.
Yeah.
I mean, literally everything has changed. And so it affected my life so profoundly. But if I didn't go through what I went through, I wouldn't have started writing.
Right.
If I wasn't an actor, it wouldn't have made me want another creative outlet. And writing books has been so profoundly rewarding for me. And it's been another outlet, different than what I had imagined. But there's also a lot of grief that goes into the loss of the life you thought that you would live. And I used to say, I felt like my life had two halves, like it was before and after, and they were separate. But then I realized they're all your life.
Right.
They're just different than you thought. It's all your life. It's just different than I thought it would have been.
How does somebody navigate that? Because there is a lot of grief that people experience when they're put in a situation physically, mentally, emotionally that they didn't really think they were going to be in or didn't anticipate that they were going to be in. You know, how did you see your way out of that?
Well, there's a long answer and a short answer. The short answer is I think it's impossible to pave through pain. And I think if you try, it just shows up later. And because illness puts you in survival mode, like you're literally in fight or flight, and I was in it for so long that I didn't realize how much I was shelving to the side for later. You know, I had been like, okay, this was bad behavior. I don't like how this person spoke to me. I'll put it on the side and deal with it later. Or this felt really bad the way that this test went, and whatever, I'll put it on for later. Or a loved one said to me, like, I don't get it. They didn't catch that. Later. And I found myself just putting things to the side. And it wasn't until after I was actually better that everything else came up for the taking because there was space.
And energy.
Yeah.
Yeah. Relationships, did it affect relationships you had as a young woman in your 20s and 30s?
100%. I had so many of people who I thought were my friends fade away. It was so sad and also a blessing looking back, because you really, when things like this happen, it's like a crucible. You really learn who your people are, because getting sick doesn't just affect you, it affects everyone that loves you.
Yeah.
And there's an opportunity to have a real deepening of relationships, but not everybody's up for that.
Right. A lot of people don't want to deal with that.
Yeah. And I also met my husband while I was struggling,
you
and we have a
did.
beautiful relationship, and we met each other during hard times in both of our lives, and I really believe we were put together to help each other through really hard things that most young people don't have to deal with.
Yep.
And then the friends that stayed, I have such a deep friendship with that. We never had that before.
Yeah.
But that's another thing. I'm curious if you see this in your practice. Like, nobody knows how to talk to somebody who's struggling, especially when they're young, and especially when it's invisible.
Mm-hmm.
I almost felt like there was this space between me and every person I loved, even the people I had the most intimate relationships with, because nobody knew what to say.
Well, probably like it's the eggshell thing. Like, can we say something? Can we not say something? Are you okay? Are you not okay? Do I bring it up? Am I going to make you cry? Like, that's probably, I'm guessing, what's happening to the people around you, you know?
Yes. And I also think in some respect, there's a lot of, I don't see it.
They don't believe you.
Yeah. And I think a lot of patients feel that way, especially young women, when they're being told, you look great.
You're fine.
You look fine. Or like, any better? You know, there's a silent messaging. And then there's the people closest to me that I know meant well. But nobody talks about how to be there for someone. And really what a patient needs is for you to ask them, how can I be there for you? How can I support you? What do you need from me? I'm so sorry you're suffering. Is there anything I can do to show up for you better?
So those are the like, if you have a friend or a loved one going through a chronic illness of any kind, that's more of the approach.
Yeah. Or I know that things have changed. Our dynamic has shifted because of what's going on with you. What is a way we can stay connected that feels good to you?
That's a good one.
I love
like
that one.
That's a really good one.
Yeah.
So you heal, you get better, but you talk about something called medical trauma brain, which I'm surprised you even showed up for this interview today because I am a physician. But anyhow, what is medical trauma brain?
Okay, so I laugh when I hear it because it's so sort of so obvious, and that's why I named it that.
Yeah.
But I found myself so much physically better. Like I said, I felt like I had a new body, but I started to feel bad in a way that I didn't understand what was happening to me. I didn't even actually realize it was happening to me. I just knew that physically I felt like I had a new body, and mentally and emotionally I was trapped in a hell that I couldn't explain. I was so anxious. I was so hypervigilant.
Like all the time?
Mm-hmm. I was so afraid that everything was going to come back exactly as it was. I was obsessive if I had the onset of anything that could have been a flare-up. And I'm not somebody that hasn't worked on myself emotionally. Right. I had been in therapy for most of the time I had been sick, but nobody had ever said this might be traumatic. Mm-hmm. And it wasn't until I went on the worst date ever with my husband.
Were you married at the time?
Uh-huh.
Okay.
When he said to me, I have to say something to you and it might sound a little provocative. And I was like, oh my God,
Here
really, dude? But I do love him because he tells it to me like it is. And he said, I think there's another phase of this going on for you. I think what you've been through is really traumatic. And I always knew there was going to be another shoe that would drop. And I'm like, a shoe? What is he even saying? And like, how is this dude who's not a medical professional saying to me that I am going through something else that's never been said to me, that's never even been a consideration? Because once you're well, you're well, right?
Right.
But I wasn't well. And I was suffering in a new way that there was no language for. And so I got help. I went to see a CBT therapist and then started learning about trauma. And I started to realize, oh, this is a version of traumatic stress. You know, there's post-traumatic stress disorder. That didn't fit because that's when one single event happens that's traumatic. Complex post-traumatic stress disorder is when the event happens over and over again. But even still, this is different. This is when the threat is your body and it's constantly betraying you and you've lost trust in it. So what happened to me was that I was physically better, but my mind was still on the survival hamster wheel and it hadn't gotten the memo. And so for me, it was like an illness after an illness.
Because you'd been in fight or flight for 20-something years.
But I think that, the 194 million Americans struggling with chronic disease, this doesn't just apply to them. It applies to cancer patients, to patients who have had acute illnesses like strokes, like horrible accidents and chronic pain. You are in survival. And unless you work to get out of survival, you will always be stuck in what I call the shadowlands, which for me, it was like I was out to dinner with my friends. I was there. I was laughing. I was having a good time. And yet there was a part of me where my brain was like trapped in a sandstorm desert all alone. And I felt so isolated. And looking back at it, I can see I was so anxious. Like I was really, really struggling because I was terrified that I was going to get sick again.
How did you get yourself out of that? And this is an aspect of illness in a journey that we don't talk about very much at all. It's always like, okay, you're better, like, okay, we're back on the horse. Yay, but there is the fallout. Right. And, how does one go about resetting that?
I worked a lot on nervous system regulation because I have a very activated nervous system from everything that I've been through. I worked with a CBT therapist. I studied immensely with trauma books and understanding that your body can actually be rewired after something severely stressful. And that then I started to think, then I think that most patients who suffer in this way, who are constantly hyper alert and feel as though their body is turning on them, need this reprogramming. We live in a country that doesn't reward recovery in any way. It's like achieve, go, do, and also
Crash.
These binaries, sick and well. No space in between. So this was something that I thought, if I'm suffering with this, then I know millions of people are too. And I started to interview thousands of patients. And when I said it, it was like a light bulb went off. And they were like, oh my God, this is exactly how I feel. And it feels like a ghost that doesn't leave you.
A medical ghost.
And then I started to interview world-renowned trauma experts like Dr. Gabor Mate and Peter Levine. And I said, it feels like the stress is like wildfire. And they both said that's how trauma can feel, when it feels out of control, when your stress response gets out of control. Not that, but, and so I said, well, I'm going to name it. And then I'm going to give a toolbox. But what was the most important part to me as a health coach who's worked with doctors is that I want patients to understand that ultimately every choice they make is up to them. And the reason that I know that people can get through this aftermath or the illness after the illness is because they were strong enough to get through the illness.
The illness, right.
So if they can do that, they can do anything. And it's so detrimental to say that the physical body is separate from the mental, emotional, spiritual self. They are one. And in this country, we look at them as separate. And they're not. There's literally no way to separate them. So I felt that I went through an extreme version of this, but I know from how many people I've interviewed that this is a real thing. Even I interviewed many, many physicians, the people that I'm closest to as well. And I said, have you seen this where the patient is better, but they're not better? Or it's like they're better, but they're still acting as if they're sick? And when I would say it, there was a real recognition of, oh yeah, I see that all the time. Or I just thought it takes time. Or yeah, and then I'd say, what's the name of it? And nobody knew. So I created it.
So you're calling it medical trauma brain.
Or MTB.
MTB. What are some of the steps? If someone listening right now is like, oh my gosh, that's me. That's the space I'm in right now. and I didn't know it had a name. Where would you tell them to start in terms of rewiring or reprogramming or calming that nervous system down?
Well, my new book, But You Look Fine, the first
Wait.
part, the first part is showing you that you might have it too. And the second part is everything you can do about it.
Okay.
So to really empower them, because it's essential that they step into this part of their healing as well, because nobody cares more about them than they do.
Right.
That's the truth.
Right.
Like, you're up to you.
Right.
And I create a whole program. But the first thing is to start to notice, okay, I'm having a big reaction to something, and create tools to understand what's happening to you. Dr. Lindsay Tolchin is a CBT therapist, and she talks about the SUD scale, which is being able to identify the spike in your stress and how distressing it feels to you, and then to create space so that you can take a little time away to say, is this really dangerous? Will this be upsetting in 2 hours, 2 weeks, or 2 months? And then another tip that I love, that I use all the time, is orienting, which is just getting into a grounded space, no matter what kind of worry you have going on, and saying, what is one thing I see? What is one thing I hear? What is one thing I taste? And what is one thing I smell? Just to really ground you into the moment. Like to take an hour. I say, like, stop, drop, and roll. Will put my phone away. I will get out of whatever situation I'm in, and I'll go for a walk. And if I can take a full sleep, I will. Like, a sleep makes everything better.
Yeah.
And then once you have calmed down, you can start to say to yourself, is this an emergency? Is this actually life-threatening? Is this going to be dangerous tomorrow? And to start to, like, kind of talk back to yourself and have a reality check. And then Peter Levine shares some really beautiful exercises in the book that people can use at any time to help to regulate their nervous system. It's also that it can't be go big or go home. It has to be one small step at a time. And there are many things that work for me that might not work for other people. I love to do breath work.
Yeah.
I love to meditate and to exercise, because there's actually science that proves that some exercise at high intensity can be more effective than a Xanax.
Wow. Yeah.
That I found.
Yeah.
And also 70% of women have experienced medical gaslighting. So the truth is, I view this as an opportunity. If people are feeling the way that I felt, that's bottom. And it's the loneliest, most isolating place to be. And so it's only up from there. And the best part is that they get to reclaim the trust within themselves that they had lost. And that is the most empowering, amazing feeling, when you get to know yourself and you say, okay, I know that everything inside of me is sounding the alarm, but I can handle it.
Yeah.
I named this stress response that I used to have Super Freak, because
Super Freak. You have good names for everything. I love it.
She, like, flies into the scene with glasses on, sideways, cape messed up, hair going crazy.
Yeah.
And now I'm like, I see you. I'm good. I got it.
Take a seat.
You know? But before, I was Super Freak.
Right.
I became her.
Yeah.
So I really think that there just needs to be a part of medicine in general that focuses on recovery and the aftermath of illness.
What happens. That's so important. Well, your latest book, tell us a little bit about it, what you're hoping people will walk away with.
It's called But You Look Fine, Trapped in the Hell Between Sick and Well, and How to Break Free.
Wow.
And it's my story, but it's also naming this phenomenon for the first time, showing people that they're not alone, and giving them so many tools for how to get themselves out of it. My hope is that it changes the narrative on what whole healing really means, because there's nothing worse than feeling like you're through a storm and yet your mind is still in it. And it literally feels like you're separated from yourself, or you're just not really there. And I do believe that healing from any kind of chronic or acute illness can be so transformative if you make it that way.
Yeah, a lot of sickness and healing is about trying to get us to that next spiritual level, right? Or that next whatever it is, that next frontier. And I, like you, don't believe that healing is just physical. That is the mission of Whole Plus. That's what we do
I know.
practically and, kind of theoretically as well. But really believing it's if you have a hit at the physical body, you're also getting a hit mentally, emotionally, energetically, and usually within your community, whatever that community looks like, right?
Yeah.
And those things work like an accordion and influence one another for sure. So it's very short-sighted. I would say this to anybody listening today or watching, that it's very short-sighted to think, okay, I cured my illness or I'm through this physical component of my journey and it's done. Like, wash your hands and you're done. There's a huge additional piece to it that never gets talked about. So I'm so glad that you are putting it to paper and getting it out there and
Thank
really
you.
helping people that might be in this place, whether they're at the beginning, middle, or end, or after a chronic health journey, which is unfortunately becoming so much more common. So thank you for sharing your wisdom and your experience and
Thank
your
you so
journey with
much.
us.
Thank you for
It's
having
been
me. I
incredible.
love talking to you.
Talk to us about where people can find you, find the book, and then I want you to answer my final question, which is what makes you whole?
Love this question. What makes me feel whole is that the physical, emotional, spiritual, mental self are all one. That's what whole healing is to me.
Speaking my language. I love it. All right. Where can people find you and find the book?
But You Look Fine will be anywhere books are sold June 9th.
June 9th. Okay.
Yeah.
Gotcha.
And you can find me on amykurtz.com or on Instagram _Amy Kurtz.
Amazing. Well, thank you again. So proud of you.
Thank you. Oh, thank you.
Is
That means a
journey.
lot.
20-something years. I can't imagine. Mine was way shorter and it almost took me out. So I can't imagine what you've been through. So thank you again.
Thank you.
And for everybody else watching and listening, again, so many people today are suffering from chronic diseases. They live in the gray zone. If you think they would benefit from hearing Amy's story, please share it with them. I think we heal in community. We heal when we hear others have been able to make it to the other side. So share this particular episode with them. And remember, we go deep on all things nervous system recovery, Lyme disease, and more in my private community, which is The Circle. Head over if you would like to join to wholeplus.co/circle. I'll see you guys next time. Before you go, remember, healing doesn't happen all at once. It happens in moments. If today's episode gave you one of those moments, subscribe and keep learning with me. The next video is right here and it picks up right where this one left off.